Welcome to Legal 123s with ByrdAdatto. Legal issues simplified through real client stories and real-world experiences. Creating simplicity in 3, 2, 1.
Welcome back to another episode of Legal 123s with ByrdAdatto. I'm your host, ByrdAdatto, with my co-host, Michael Byrd.
Thanks, Brad. As a business and healthcare law firm, we represent clients in multiple sectors and multiple specialties, especially healthcare. This season, our theme is Specialty Spotlight, where each episode we'll visit about some of the nuances that can be found from a business and healthcare perspective in the various practice specialties.
Michael, why do you look sad today?
I read a story, Brad. I know it's going to make you sad, and so I'm feeling sad. In fact, I'm feeling so sad that I brought a licensed professional counselor in studio because you're not going to do well with this. Just please don't shoot the messenger.
Is it about the Saints?
We would have canceled.
Okay.
No, there's been a recent change that threatens Elvis-themed weddings in Las Vegas.
What?
Yes.
Oh, my dreams are all crushed. Yes. I was going to get remarried again to my wife by Elvis.
Yes. Well, apparently, Brad, the company that controls the Elvis brand sent cease and desist letters to multiple Elvis-themed chapels in Las Vegas. These letters order them to stop using the king's likeness in their weddings.
This makes no sense. Elvis weddings have been going on in Vegas forever.
I know. Well, and there's been a ton of publicity about this because the Las Vegas wedding industry has only recently started to rebound from the pre-pandemic levels. And I saw a quote, one particular chapel owner who said that 95% of their weddings are Elvis weddings.
So why is this all of a sudden happening now? Did COVID cause this?
We don't really know. The owner is called Authentic Brands Group, and they acquired the Elvis Presley intellectual property rights in 2013. Well, at least that's what Siri told me. I saw another quote from an article noting that the massive amount of revenues from publishing and licensing rights for Elvis are just continue to this day. In fact, I saw that Graceland netted over $12 million in merchandise and memorabilia sales in 2019.
Yeah, I'm wondering how strong a case they're going to have against these chapels. And I don't want to get too legal, but Elvis is a pretty massive name.
I know, and name or likeness laws can vary quite a bit. Nevada actually has protections for live performances, which is, of course, why there's been a lot of celebrity impersonators in Nevada.
So what I just heard is, Brad, will you impersonate Elvis?
You're losing focus, Brad. Okay. Some of the critics of these cease and desist letters have kind of drawn the parallel to trademark trolling.
When you said that, why did you look at me and said trolling?
Slow down. We're not calling you a troll, Brad. Okay. Plus, you're a self-declared hobbit.
It's true. What are these trademark trolls? What's this referencing?
So trademark trolls, they may actually have a right to a name, and then they actually are just going out and searching for others to use a name, which actually people that police their marks, that's normal. However, for them, they're not trying to shut it down. They're just looking to scare people and get them into paying a settlement or licensing rights.
Yeah, it gets real messy real fast.
Yeah, and it actually gets more complicated when you're dealing with a celebrity, because if they become an icon or a cultural symbol, I think we can all agree Elvis has arrived.
I thought you meant icon celebrity.
Well, they're more likely to be considered fair game for works of, quote, artistic expression. So the First Amendment becomes a very strong argument at that point. When someone becomes so famous, it actually ends up working against the name and likeness owners.
So I'm trying to figure that out. So today's guest, she's an Elvis impersonator?
Oh, Brad. Okay. She's here to comfort you. Okay. And you can only dream. Our guest today is a licensed professional counselor. And she actually, many years ago, we first met her when she worked with my wife, Stephanie, and I in our pre-marriage counseling. And no, Brad, we did not have an Elvis-themed wedding.
Okay. So what I just heard is our guest has dirt on you. And I think I might change the questions I was going to ask her. But first, Michael, let me ask you this question. How much did you pay her on the table to make sure she would not tell Stephanie to run for the hills?
Very, very fair point, unfortunately. I had to sweat through the pre-marriage counseling process and pray that Stephanie would not make that choice on her own. Thankfully, there's confidentiality to these pre-marriage counseling conversations. And I am definitely not waiving that privilege for you to get more information to use against me and make fun of me.
Okay, well, if we're not having a guest here today, what's going on here?
We're having our guest on today because of the specialty spotlight theme, Brad.
Okay.
You got distracted by the Elvis conversation.
I did.
In the news.
Yeah.
And we get to learn about licensed professional counseling.
All right, perfect. Let's bring her on.
Okay. Our guest today is Brandi Sinclair. Brandi founded Heritage Counseling in 2004. Brandi is licensed as a professional counselor and has been in private practice for many years, has over 20 years of experience. She is a graduate with a Bachelor of Arts in Psychology and a Master of Arts in Clinical Psychology from Southern Methodist University, and is a prolific speaker. And Brandi, we are so glad to have you. Welcome.
Well, I'm so glad to be here with you guys. You guys are hilarious.
Well, I appreciate that. I think I am. I'm not sure about Michael, but
Yeah.
I take that. I think she said I was hysterical, is what I heard.
And he's also saying that we might need some kind of business marriage counseling.
Probably.
Well, I can certainly help you with that. I work with a lot of executives and interestingly, a lot of attorneys. Not
Yes.
sure what that implies.
Yes, I could see that. Well, we're gonna have to put you on the spot right here. I mean, given everything we just talked about, and especially with your role in the premarital counseling, have you ever had to counsel someone on right before they went to get married by Elvis?
I don't believe I've ever counseled anyone that was planning an Elvis wedding.
Interesting.
I feel like Elvis weddings probably tend to be more spontaneous.
Perhaps they are. And perhaps a lot of alcohol is involved. And I doubt very seriously if most of those people are getting premarital counseling.
I wonder if afterwards they could have your card after they get married if they need to have counseling.
That could be a really great marketing tool. We could just put our cards at all of the Elvis wedding facilities, and then perhaps that would drive some business.
There you go.
Oh, good. Well, we are so glad to have you here. And the whole behavioral health sector is just booming these years. And everyone I talk to, including you, Brandi, we know it's there's just a lot of need. I'm sure COVID had a lot to do with it as a propellant. But I'd love to start to have you kind of introduce your specialty, introduce kind of professional counseling to our audience.
Well, professional counseling, from my perspective, is a fantastic career. There is such a high need right now. In our field, there's lots of different licensures. There's licensed professional counselors. There's licensed social workers. There's licensed psychologists and psychiatrists. So differing kinds of people provide different kinds of services. For our practice, we are a fee-for-service practice, and we have both licensed psychologists and licensed professional counselors, and we see a variety of different kinds of people. But basically what we're doing is we are treating the mental and emotional health of our patient and client base.
That's great. And talk a little bit about how with all these different disciplines or licenses that are kind of in your field, how do y'all work together? Do y'all, for example, work together on the same patient, or do y'all have your own lanes that you tend to stay in?
Well, it really kind of depends on the practice. In our practice specific, we are an extremely collaborative practice. We do a lot of family systems work. We have people who can do marriage counseling. We do child and play therapy and adolescent therapy, and we treat grief. So we could work with lots of different people in one family, actually. And so we in our practice have a very collaborative effort. We do neurofeedback. We can provide psychiatry services. So we have a very diverse practice, and we have lots of treatment modalities, and we can work with lots of different kinds of people. So lots of collaboration in our practice.
Yeah.
Statistically speaking, there are lots of practices that have multiple therapists in there, but they don't have the same collaborative approach. We also work with physicians. We work very, very closely with physicians, and that actually is probably our largest referral base, other than patient to patient referral. But we work with these physicians and we work with psychiatrists who are not in our practice too, taking really great care of our patient population.
So it's interesting. And so a patient presents themselves, and then y'all decide who would be best to help work with them based on that collaboration.
We do, and in fact, we have a large support staff and an admin staff, and the admin staff take our calls and do their very best to place each individual patient with the right therapist, depending on the style of therapy that they practice, depending on what the patient need is. That also is a little bit unique to our practice because many practices, if you take the call, you get the client, and so we're very intentional about placing each person with the right therapist.
Mhm.
And I'm guessing that there probably, I could see circumstances where a psychiatrist, as you mentioned, would refer to you, and then vice versa, where you would have someone that you would think needs to be referred to a psychiatrist.
Yes, we have a really strong referral process coming both into our practice from physicians and psychiatry and even other therapists. And then we refer out. And we have a person that specializes in our office in referrals. So in other words, they're looking at the different kinds of inpatient facilities for mental health and addiction, troubled teen. So we do a lot of referring out to. We're also looking for the right psychiatrist. So if the psychiatrist that we work with is not, that's not the right fit, then we're looking for an even better placement. That might be in the case of someone of a young child that needs psychiatry help.
Hmm. So now we've been talking about patients, but what is one of the biggest challenges that you have in your specialty when you're handling those patients?
Probably the biggest challenge that we have is getting people to call us before they are in such a crisis state.
Mhm.
Mental health still has a lot of stigma associated with that. And so we just want to encourage others to consider treatment well before you're in a state of crisis. This is another thing that we do with our physicians. We try to educate them on doing a good job of finding out what the mental and emotional condition of each one of their patients is and treating that before it gets to a place of crisis.
Did you notice a difference with COVID on crisis?
Lots and lots of differences. There's a lot, we're going to be seeing a lot of residual negative emotional and mental health issues because of COVID. Lots and lots of things going on there.
And, it's one of those. So I grew up in my family. My grandpa was a psychoanalyst, and so when you hurt your arm, my dad was an orthopedist, so you would go see an orthopedist, right? So, but a lot of people, they don't know that when something's strongly, you're having trouble with it and you can't figure it out, you think you're supposed to do it yourself. In my family, you were like, oh, go see someone about that. And so I was one of those rare families that was a normal part of the outcome, that you should be seeing that, because it's just like when you hurt your arm, you see someone who you can't figure it out and you're troubled by it, you go see somebody, a therapist, to help you through that process. But I learned later in life I was rare in that sense. But hopefully with COVID, a positive outcome is so many people are getting into this field right now. So many people are reaching out for help, and maybe it'll take some of that stigma away from it.
Well, I hope so. I think that collectively the field of mental health is growing and has become more palpable. It's always had such a stigma associated with it, and you're correct, Brad. It's that thinking of, I'm supposed to be able to handle this on my own, and if I seek help in the mental or emotional health field, then I'm weak and I can't do it on my own. And I think a lot of people also fear that medication is going to be the line of treatment.
Right.
And that's just not the case. What we do is in our practice specifically, we're very heavy on cognitive behavioral therapy. We're eclectic in a lot of ways. We have lots of different theoretical treatment programs, but a lot of cognitive behavioral therapy. And basically what that means is examining how you think about the world around you and yourself in it, how you react to those things. And when you go to counseling, it's assessing those things and figuring out what the trouble areas are, and finding new ways of managing so that you net a better outcome.
That's awesome. Do you think the patients have a lack of understanding? It sounds like you kind of alluded to this, where they think it's going to be necessarily medically or prescriptive medicine as the treatment, do they have an understanding of what actually goes into getting counseling?
I think a lot of people don't. In fact, I think some people think that you go into a counseling office and lay on the sofa, and it's a somewhat dark room, and there's a person sitting in a chair kind of behind you, writing on a tablet, hoping that you figure it out while you're laying there. It's completely different than that. I'm a very interactive therapist, and I have homework, and it's more of a vivacious event and a collaborative effort together of figuring out how we can create change.
So if a patient presents themselves and they're like, I want the red pill or the blue pill, whatever it is they believe is going to solve their issue, is that someone you're like, I'm not sure if I'm a good fit for you?
That's exactly correct. It doesn't mean that a pill won't be necessary somewhere down the road, but if the pill's what you're looking for, psychiatry is the stop that you need to make.
Yeah.
Interesting. Well, so there's also a business side to your specialty, and like any business, and most in professional counseling and all of behavioral health tends to still be small businesses. Love to kind of hear your perspective on the business challenges, kind of from that side of things in your specialty.
Well, we're very fortunate because we have a large administrative staff that helps us with the business part of our business. Statistically speaking, counselors do not have a good business acumen, which is kind of the challenge in the field. Is that we're very trained at our own in our own area, but the business area falls by the wayside. Unfortunately, it's expensive to have that help, but I think it's a real necessary part of being successful.
Yeah, I can agree with you on that one. We have seen many lawyers who are really good lawyers. Many other types of physicians are really good at being, surgeons, but the business side of it slips away from them.
What's your favorite part about the business side, or parts of it that you enjoy as a counselor?
I really love the business side, and I would say when I got started, I thought I had some business acumen, but I learned pretty quickly as we grew that I was not as skilled as I thought I was, and so hiring good people was necessary. I enjoy the people development of our practice. We have quite a few therapists, and it's really nice to do the people development on the back side, not just the client care on the front side.
Yeah, I bet that y'all are very well equipped for healthy conversations.
Well, we try, and we do a fair amount of bantering like the two of you do, which I think is really helpful for us too.
Did the bantering ever get out of control where someone says, I know you're trying to use that technique on me and it's not going to work because I've trained on that technique?
I would say that occasionally it gets a little out of control, but we have to offload some of that energy that comes to us from our patients and clients, and so I think that bantering is pretty healthy, actually.
That's probably fair. I mean, I know that we get a lot of feedback from our clients that sometimes we wish we wouldn't get, but yeah, that's part of your job in the sense of bad things happen to them and they tell us about it, but no one else is supposed to know about it. And I think that's probably something that you guys actually care every single day. How do you all handle that stress wise?
That's a really great question. In our field collectively, self-care is critically important. Mm-hmm. And from my perspective, I think the collaboration is the key. From the very beginning, I did not want to practice in a solo office. I wanted to have other professionals. I wanted to have different treatment modalities and different perspectives. We have a weekly meeting where we debrief, and it's an opportunity not to share names and circumstances, but for us to address challenges that we may be having with the patient or client, and for us to talk about the impact of what's going on in our day to day with other clinicians who are slightly skilled to help each other.
Yeah, that makes sense. I mean, the word collaboration is a word that rings true with us too, just because the area of law that we are in gets so complicated. The number of days that we get together and talk about that is crucial for us, for our growth, mostly for Michael's growth because he's so immature. But it really is something that I think you said something that I've said all the time. I could not imagine being a healthcare attorney and practicing on an island by myself. The ability to walk down the hall and talk to other people and collaborate, or get a group together and collaborate, is a huge part of that. And I do think it does help mentally too, because you're not alone when someone says, you hearing this over and over again? Yeah, but it's not correct.
Yes, and I love the collaborative aspect of our field, and I think it's necessary in order for you to keep your skills up. It's one of the reasons why people really love working for us or with us.
Yeah. So we've talked about patients. We've talked about the business. What type of business healthcare compliance challenges do you face in this specialty?
We don't have a lot of healthcare compliance challenges because we are a fee-for-service practice.
Mhm.
I'll tell you that a great challenge, though, is helping our patients and clients get reimbursement from their insurance. We had a
Mhm.
real interesting thing happening during COVID. My staff did some research and started working with insurance companies to get approval for out-of-network payments, even though people may have had their policies may have had high deductibles or may have not had that as an option. So that was a really nice. It was a really nice benefit that we got to see happen. But typically, the management of the insurance companies and getting reimbursement, helping our clients get reimbursement, is probably the greatest challenge.
Yeah, and it's pretty common, just as an observation in your field, for uh, that responsibility to be put on the patients, and they're kind of on their own to just kind of seek reimbursements for whatever benefits they have.
Well, that's another benefit of working with our practice is that we have this administrative staff who has a lot of skills in the insurance reimbursement area, and so you have a little bit of help there. There's lots and lots of therapists, and in fact, I would say maybe over 50% of therapists are fee for service currently. And so the patient, if you are a solo practice, you don't have the time to help your patients and clients get information to help them get that reimbursement. But in our practice, we have staff that really helps you to try to make that work out.
That makes sense.
Have you experienced any challenges just working with others who may have different licenses? And are there any kind of compliance or business uh, obstacles that you faced going down that road?
Yes, the great obstacle that we have had is bringing psychiatry into our practice. And we feel like it's a real necessary part of our success. But when you're not licensed at the same level, it presents a business challenge. And so we've hired this really great team of attorneys called ByrdAdatto who have worked hard to help us find ways to manage this.
Yeah,
Yes.
I've heard about that. There's all these rumors going on. Who knows? But not
Listen.
quite on par with Elvis weddings.
Yes. I think I've heard of them too. I think the last question I want to ask, and if you can't answer it, it's fine. We were talking about reimbursements, and it dawned on me that Stephanie Byrd reached out and asked for reimbursement for you not counseling her better, that she should not have married this guy, or is that something you cannot answer?
The rules of confidentiality definitely apply.
Okay, all right.
Man.
Well, so I thought I had something there.
Well, once again, time flew by. We are so grateful to have had you on the show. What we'll do next is we'll say goodbye to our awesome guest, Brandi Sinclair, and we'll go into a commercial. And on the other side, we'll do our little legal wrap up. And really grateful that you were on today.
Thank you so much for having me. You guys are a lot of fun.
Many business owners use legal counsel as a last resort rather than as a proactive tool that can further their success. Why? For most, it's the fear of unknown legal costs. ByrdAdatto's Access Plus program makes it possible for you to get the ongoing legal assistance you need for one predictable monthly fee. That gives you unlimited phone and email access to the legal team, so you can receive feedback on legal concerns as they arise. Access Plus, a smarter, simpler way to access legal services. Find out more. Visit ByrdAdatto.com today.
Well, welcome back to Legal 123s with ByrdAdatto. I'm your host, Braddo, with my co-host, Michael Byrd. Now, Michael, this season we have been working real hard to find the specialty spotlight. And wow, we had some amazing guests so far. And each time we have a new guest, we're like, wow, this person's even more amazing. Nothing against our other guests, but Brandi brought in a lot of information that's very unique because of her background. And it's not your typical medical practice stuff that we learned from her, really from the behavioral side. There's a lot of nuances that a typical practice does not face.
Yeah, we tend to have a lot of medical focus conversations with physicians, and the conversations flow from regulation from the medical board, it's important to realize that every licensed professional discipline out there, whether it's professional counseling, dentistry, medicine, et cetera, they all have their own kind of licensing requirements and things that flow from that. And kind of Brandi brought to light something that is a really big part of behavioral health, which is you have professionals of multiple licenses and license types trying to work together.
Mm-hmm.
And most of them they're independent of each other,
Yeah.
or at least substantially independent of each other. And
Right.
so trying to figure out how to set up a business, on our end as attorneys, so that they're working together compliantly and also, trying to create as seamless of an experience for the patients is quite challenging. It's very state driven.
Absolutely.
We've talked before about the management services organization model that ends up being necessary in behavioral health quite often, even when it's all professionals that are owners, because you're trying to figure out ways where in some circumstances, in Texas is a good example, a physician and a licensed professional counselor can't co-own a business that practices together. But there's ways to do it. It's just it is interesting in the sense that integrated medicine in many disciplines, including behavioral health, is growing in over the years, in recent years in particular. Yet, the laws haven't tended to catch up as to how everyone can play together in the same sandbox.
Yeah, and we've talked about the court practice of medicine a lot, but the court practice of mental health is also something that it goes back to the same level, which is can and this goes back to it, can an MD and someone who is a behavioral health person, can they co-own a business together? And every single state, believe it or not, is different on that rule too, and how that works, and how even someone who's not a licensed professional, just your entrepreneur, how they can work with them. And so to your point, the MSO model does come in play in a lot of times, so that collaboration to the patient feels normal, but there's a lot of moving parts in the background inside of an MSO model, so they can be fully compliant. Again, that's a really good point to take away. Any other final thoughts, Michael?
That's it.
Yeah. So my final thought is, audience members, if you're watching live, Michael did not break into his Elvis impersonation. If you have never seen it, it's amazing. Riley, don't you think Riley's nodding her head. I've never seen Michael do that, audience members. Okay.
Well, Michael, unfortunately, that is all the time we have today. Lots of fun. But next week, we have our good friend and client, Dr. Jay Burns, who will be coming to join us in studio. Thanks again for joining us today. And remember, if you like this episode, please subscribe. Make sure to give us a 5-star rating and share with your friends.
You can also sign up for the ByrdAdatto newsletter by going to our website at ByrdAdatto.com.
ByrdAdatto is providing this podcast as a public service. This podcast is for educational purposes only. This podcast does not constitute legal advice, nor does it establish an attorney-client relationship. Reference to any specific product or entity does not constitute an endorsement or recommendation by ByrdAdatto. The views expressed by guests are their own, and their appearance on the program does not imply an endorsement of them or any entity they represent. Please consult with an attorney on your legal issues.